Let's break down gallstones, hardened deposits that form in your gallbladder, a small organ under your liver that stores bile. Most gallstones are made of cholesterol or bilirubin, ranging from tiny grains to golf ball size. They're usually harmless, but if they block a bile duct, you get pain and complications. Who's at risk? Remember the 4 F's: female, 40, fertile, and fat. But don't stop there. Family history, diabetes, and rapid weight loss also raise your risk. Cholelithiasis is the medical term for gallstones. Cholesterol. Stones are the most common type. Spotting these risk factors helps us identify patients who might have gallstones. Many people live with silent gallstones, completely unaware of their presence. They experience no symptoms, and as long as there's no discomfort or disruption, there's no problem. These gallstones remain benign and require no intervention. However, trouble begins when a gallstone obstructs a duct, usually the cystic duct. This blockage causes a sudden, intense pain in the right upper abdomen, a hallmark symptom of gallbladder issues. This pain often manifests after consuming fatty meals, as the gallbladder contracts to release bile for digestion. The pain can be quite sharp and may radiate to the back, causing further discomfort. In some cases, the pain can even extend to the right shoulder, a phenomenon known as referred pain. Accompanying the pain, you might experience nausea, a feeling of unease in the stomach. This nausea can escalate to vomiting as the body attempts to expel the contents of the stomach. Abdominal bloating, a sensation of fullness and swelling in the abdomen, is another common symptom. If the gallbladder becomes inflamed due to the blockage, the condition is called cholecystitis, requiring prompt medical attention. To assess for cholecystitis, Murphy's sign is a key indicator. The examiner will gently press under the right rib cage, specifically at the location of the gallbladder. If the patient experiences a sharp increase in pain and abruptly stops breathing in due to the discomfort, it's a positive Murphy's sign, strongly suggesting cholecystitis. So how is a diagnosis reached? An abdominal ultrasound is typically the gold standard for visualizing the gallbladder and detecting gallstones. In addition to imaging, laboratory tests are crucial to check for signs of infection and assess liver function. Specifically, doctors look for an elevated white blood cell count, which indicates an inflammatory response. They also monitor liver enzymes such as ALT and AST to evaluate liver health. Bilirubin levels are also assessed, as elevated bilirubin can indicate a blockage in the bile duct. Jaundice, characterized by yellowing of the skin and eyes, can occur if a stone obstructs the common bile duct, preventing bilirubin from being properly excreted. Ultimately, diagnosis involves carefully connecting the patient's reported symptoms, the findings from the physical examination, including maneuvers like Murphy's sign, and the results of imaging and laboratory tests to arrive at an accurate diagnosis. For individuals experiencing mild symptoms, or for those who might not be ideal candidates for surgery due to other health concerns, the initial approach often involves making significant diet changes. This primarily means avoiding fatty foods, which can trigger gallbladder issues. Alongside dietary adjustments, managing pain is crucial. Over-the-counter pain relievers can sometimes provide relief during milder episodes. However, for the majority of patients experiencing persistent and bothersome symptoms, surgery becomes necessary. The gold standard surgical procedure is a laparoscopic cholecystectomy. This minimally invasive technique removes the gallbladder through several small incisions in the abdomen. This approach allows for a quicker recovery time and reduced post-operative discomfort. In some instances, a gallstone may migrate and block the common bile duct, causing further complications. In such cases, an ERCP, or endoscopic retrograde cholangiopancreatography, procedure is performed to remove the obstructing stone. This involves using a flexible endoscope, equipped with a camera and specialized tools, to access and clear the bile duct through the digestive tract. It's important to remember that even after gallbladder removal, the liver continues to produce bile. However, instead of being stored in the gallbladder, the bile now flows directly into the small intestine. For most individuals, this direct flow doesn't pose significant problems, and they can digest fats without issue. However, a small percentage of people may experience temporary bloating or diarrhea, particularly after consuming large, fatty meals. Therefore, it's generally recommended to gradually reintroduce fats into your diet following surgery. Overall, life without a gallbladder is quite manageable for the vast majority of individuals who undergo the procedure. Ultimately, surgery remains the most effective way to definitively prevent future gallbladder attacks and alleviate associated symptoms. Nurses play a vital role in preparing patients for surgery. This crucial phase sets the stage for a successful procedure and a smooth recovery. They educate, providing clear and concise information about what to expect before, during, and after the operation. Confirm NPO status meticulously, ensuring the patient has followed the necessary fasting guidelines to prevent complications during anesthesia. Start IVs, establishing a lifeline for medication administration and fluid replacement throughout the surgical process, and offer reassurance, providing emotional support to alleviate anxiety and build trust with the patient. A calm patient is often a better patient. After surgery, diligent monitoring is key. Closely monitor for pain, assessing its location, intensity, and characteristics, especially shoulder pain from gas, a common side effect of laparoscopic procedures requiring specific interventions. Encourage walking, promoting circulation, preventing blood clots, and aiding in the return of bowel function. And check incisions for infection, observing for signs of redness, swelling, drainage, and increased tenderness. Start with clear liquids, then advance to low-fat foods as tolerated, gradually reintroducing solid foods to prevent nausea and vomiting. Teach patients to avoid fatty foods at first as the digestive system recovers, minimizing discomfort and promoting healing. Care for wounds, providing detailed instructions on proper cleaning, dressing changes, and signs of complications to watch for. And watch for complications like fever or worsening pain, which could indicate infection or other underlying issues requiring prompt attention. Key NCLEX facts. 4 F's for risk. Remember the mnemonic. Female, 40, fertile, and fair. Key risk factors for gallbladder disease. Right upper quadrant pain, a hallmark symptom of gallbladder issues, often occurring after meals. Murphy's sign, a clinical assessment technique used to identify gallbladder inflammation. Ultrasound for diagnosis, a non-invasive imaging method to visualize the gallbladder and detect gallstones. And laparoscopic surgery as the fix, a minimally invasive procedure to remove the gallbladder. Remember the gall mnemonic. Greasy food intolerance, a common symptom where fatty foods trigger discomfort. Abdominal pain, often described as sharp or cramping, located in the upper abdomen. Labs, including liver function tests and complete blood count, to assess overall health. And laparoscopic surgery, the gold standard for gallbladder removal, offering quicker recovery. Patient education and monitoring are crucial for recovery, ensuring patients understand their medications, diet, and follow-up appointments. Master these essentials for exams and real-life care, building a solid foundation for your nursing career. You've got this. Remember to stay focused, stay positive, and believe in your abilities.